Welcome to Healthy Point of View Podcast, where we explore the latest trends and topics in health and wellness. Whether you're looking for tips on nutrition, fitness, mental health, or anything in between, we've got you covered. Join us as we chat with experts, share stories, and learn how to live a healthier and happier life.
Welcome to a Healthy Point of View Podcast. I'm your host, Sam Tejada, and today we have Dr. Christopher Davis, who is Liquivida's Chief Medical Officer, also specializing in functional medicine. He is formerly trained as an interventional cardiologist. Dr. Davis has been a great friend and also a mentor and has taught me a lot of this stuff here in the functional medicine space. Dr. Davis, how are you?
Great, Sam. It's good to be here. Good to be here as usual at Liquivida's corporate office. So
yeah, man.
Looking forward. This first time we've done this, so looking forward to talking and educating, doing what we do.
That's what we do best.
Yeah.
So today's topic is going to be about how to enhance your body to build its best immune system, right? How to enhance your immune system through a lot of the different nutrients, IV infusions we do, vitamin injections that we do, other different type of modalities for gut health. Mm-hmm. So a lot of people out there, you know, they're stuck into that traditional medicine, right? Where they kind of wait until they get sick and then they want an antibiotic and this, that, whatever. And for me, you know, how we always try to preach to everyone, it's like, why wait until you get sick, right? What can people do to enhance their immune system?
Well, you know, first I'll say that, you know, just like you mentioned, it's very important to be more proactive about our health. I think that if any of us are waiting around for somebody else to take care of your health, I think we're all in for a sad surprise. As far as the things we can do, I'd like to consider 5 basic pillars of kind of health and wellness. And those same 5 pillars really are relatable to the immune system as well. And it starts with proper nutrition. It includes things like proper sleep, hormone balance, detoxification, which I think we'll talk about hopefully a lot, because I think a lot of our illnesses, including infections and things, are related to toxins that build up. And then the last thing is some form of movement or exercise. All of those things help to improve the immune system.
Right. So proper nutrition. I hear it all the time. People tell me, I eat clean. What is I eat clean? What is proper nutrition?
Well,
what do they do? They put soap on the fruits and vegetables. Is that eating clean? What's eating clean?
So, you know, that's a great question. And so one of the things that I always say is, I'll answer the question about eating clean, but then the question becomes what's right, or what's the best diet for anybody to be on? I'll answer that in a second. But eating clean, I think I'll answer that question just by saying, you know, eating organic, eating, you know, if we are someone who consumes meat, eating grass-fed and finished products, organic products, you know, it's very tough sometimes. Even myself, I laugh about an experience I had. I was in Publix and the organic raspberries were $5 a carton, and the regular raspberries were get 4 for $5 or something like that. Wow. And I remember one Sunday morning, this is a true story, I called my wife and I said, honey, I'm having some issues right now because, you know, how do I know that, you know, these organic raspberries, what's the difference in these organic raspberries as opposed to the ones that are not organic? And I preach in my practice about the importance of organic and making sure that you're avoiding the pesticides and herbicides and things like that. But at the end of the day, how can I ever be sure? You know, the answer to that question, I can't be sure, but we just have to trust that they are. And I went ahead and bought the organic, but I think that part of eating clean is drinking clean water, organic foods, avoiding other toxins in our environment like plastics, our cooking utensils, the things that the pans and pots that we cook with, making sure that we're avoiding some of the toxins that are in those.
So let's talk about that. Let's talk about some of those toxins that you can get exposed to, like pesticides, some of the plastics, some of that bad water, right? Yeah. What does that do to your body?
Well, you know, the biggest thing, if I want to take it, you know, in kind of a general principle, is that they cause increased oxidative stress. Right, all of these toxins are caustic to our body, and oxidative stress, I like to call it getting rusty inside. You know, and as we age, we are actually getting rusty inside. I always use with my patients an analogy of a metal pipe. We have these metal pipes, and you think about a 200-year-old house with a metal pipe, and in that metal pipe, these layers of this orange layers just keep developing and developing and developing layer upon layer. Wow. That's oxidative stress inside that pipe, right? And so these reactive oxygen species cause us to get older. They cause us to have aches and pains in our knees and to develop heart disease and Alzheimer's and Parkinson's disease. And so every one of those toxins, whether it's an herbicide like glyphosate or Roundup, or whether it's something like heavy metals or plastics, phthalates in our environment. I mean, there's so many things in our water. We order environmental toxin testing on a lot of our patients to see exactly, particularly people who have cancers, though, or I have a friend of mine who has a bunch of skin cancers, and they keep coming back, and he was a firefighter. And I said, I bet you there's some chemicals that are likely causing a lot of oxidative stress. And so we get the environmental toxin test, and lo and behold, there's just tons of toxins that we have to make sure that we try to help him, mobilize and get out after years of exposure. Wow. So there are toxins everywhere in our environment. We can't avoid them, but it's important that we know how to optimize our detox pathways, which is a lot of what we do with IV nutrient therapy and nutrient therapy in general.
Yeah. You bringing up the whole nutrient stuff. So going back to avoiding the pesticides, going more towards like the organic foods and stuff. One of the things that I know myself is that a lot of the food that's massively produced is lacking in a lot of nutrients. It's nutrient deficient. I actually tell people it's hospitality fruits and vegetables. What we have, they look beautiful. But they have no nutrients. They don't even have taste. You go to Costa Rica, take a bite out of a strawberry, it's like this magic just happened in your mouth, right? So part of that is, okay, we're going to eat organic foods, but we've all been, at least myself, I can speak for myself, that I've been guilty to not always eat organic foods, right? The way I grew up was completely different. I mean, we were eating the most readily available food on planet Earth. That's almost like survival mode type of deal, which I think about 90% of the population is like that. Yeah. So what do we do from a nutrients perspective? Because we're talking about boosting up the immune system. What are some of the things that we can do to correct that, besides just eating organically, by some of these different modalities that are out there? Yeah.
I think that one of the things that here at Liquivida, some of the benefits of intravenous IV therapy is we can provide these nutrients in concentrations that are able to not only get into the serum, but also get intracellularly, meaning getting into the cells and doing what they need to do in the cells, the red blood cells, the white blood cells. Right. I think in addition to the poor nutrient status of poor nutrients in the soil, our consumption of the nutrients, we also now are dealing with a population that at least 60 to 70% of us probably have some component of leaky gut, or what we call increased intestinal permeability, right?
And that doesn't really allow you to get absorption,
so the
right?
Absorption is extremely poor. There are lots of tests and gut microbiome tests and gut testing that allow us to evaluate this. And I can't tell you the number of times we see people that have the leaky gut, but not only do they have leaky gut, they have very poor digestive enzymes. And I'm not sure exactly why the digestive enzyme issue is such an issue, but as far as even digestion of your food to be able to get access to the nutrients, there are lots and lots of people who have these deficiencies in the digestive enzymes. So now we are compounding a problem of not having food, not having the nutrients in the soil to get in the food, eating the wrong food, and then poor gut health not to absorb it. So I think we're set up for just poor nutrition, and we see that in our micronutrient testing.
Whoa, hold on one second. So correct me if I'm wrong here. So you mean to tell me that even if I start eating healthier, taking like oral supplements, and I have like a leaky gut issue, that I wouldn't even probably get good absorption of those nutrients because of that?
Very commonly, very, very commonly, I see people who eat extremely well. I mean, I could think of 10 people right now that eat extremely well, yet when we look at their micronutrient panel, they're still deficient in many, many of the micronutrients.
The people have to know about this. This is extremely important, because a lot of people that says, you know what, New Year's resolution or whatever, I'm going to just take that leap. I'm going to start eating clean, right? Eating clean. I'm going to start taking these supplements, right? But now they're thinking that they're doing something better. They're not even getting an absorption. They're basically staying stagnant at that point.
There's an old adage that, test, don't guess. And what do I mean by that? That's not wonder whether I have enough vitamin B2 or B6 or B9. why don't we evaluate that? And so that's
some
something that we
gas.
here at Liquivida, we really strive to promote as much of the micronutrient testing as possible, because what I've learned, particularly with specific tests that look at the serum and intracellular levels, is that there are lots of people who have low intracellular levels of these micronutrients.
Okay.
So they're not able to carry out, and these micronutrients are important in they're cofactors in so many different processes. Cofactors in how we metabolize our hormones, cofactors in, how we metabolize our neurotransmitters. When you're not metabolizing neurotransmitters well, you don't sleep well, you're depressed, you're angry, you're anxious. So it's little things like this. The number of people that you're able to help, that I've helped with issues like depression and anxiety just by fixing micronutrients has been incredible.
Wow.
But it only started by being able to evaluate those micronutrients and seeing, wow, there's a lot of folate deficiency and B2 deficiency here, and they're probably not methylating well. So why don't we try to improve that with IV therapy, or with even a conjunction of IV and oral? But again, if you're not absorbing orally, then IV therapy is a great way, because of the concentrations that we get into the serum. There's a much higher chance that we're able to get those micronutrients across the cell membrane just because of concentration gradients. So that's the purpose. And people will often argue, well, we just get these high levels and they go out of this, they get out of the body. Well, no, we got to back up. What happens is that high concentration allows us now to cross the cell membrane into the cell. The white blood cells will live for 14 to 21 days, right? So yeah, I might not be able to measure it in the serum because the half-life will shorten the serum. But what did I do with that micronutrient getting intracellular? And those where we see differences with IV nutrient therapy.
Wow. That is, you're fixing the body's chemistry at that point.
Yeah.
With what you're doing. And, I've heard you say it a lot of the times, and I've been stealing your lingo, right? Looking under the hood.
Yeah.
So looking under the hood is critical. Even like if you got a car, right?
Mm-hmm.
Car that's not performing right, what is the mechanic going to do? It's going to look under the hood. They're not just going to guess. We got to figure out, we got to do a diagnostic to figure out what's going on.
Yeah.
So let's say we do the diagnostic. We have a lot of nutrients deficiencies. What are some of these nutrients that are in some of our IV drips, like the natural defense, right?
Yeah.
The natural defense. What are some of these nutrients that are going to help enhance and boost up our immune system? Especially now that we got, we're in fall. It's, we're going into winter, the flu season, cold. We're talking about potentially other type of viruses out there that airborne viruses that might come around. Like, people need to be prepared. They got to take care of themselves.
Yep.
What is inside of this natural defense that's going to help boost up the immune system?
So a few micronutrients there that are really important: zinc, magnesium, several B vitamins, vitamin B1, vitamin B2, which is riboflavin. We have vitamin B5, pantothenic acid, vitamin C, right? These are all things that we know are really important in the immune system, and they're in many different ways they help the immune system function. But I think if I were to give you the most important role of most of these micronutrients, and not a lot of people think about this, we need oxidative. I said oxidative stress I implied that it was a bad thing earlier, right? Oxidative stress causes us to get old because it's what causes us to get rusty. Well, the reality is, God didn't give us the oxidative stress and these reactive oxygen species just to be bad, right? We need these reactive oxygen species as a means of protecting ourselves as well. So our neutrophils, these white blood cells that help to destroy viruses and bacteria, they work by producing reactive oxygen species, hydrogen peroxide, to help destroy these organisms. But our body then in turn has to be able to, now once the reactive oxygen species have done that part, the oxidative stress has to be somewhat quelled with the antioxidants. And that antioxidant that's most important is glutathione. So we've heard of glutathione. Now, glutathione is not in our natural defense drip, but my point is this: glutathione has to be recycled in our body. And that recycling, what's important in that recycling is all those other vitamins that I just talked about. Zinc is very important in the recycling. Vitamin C is very important in the recycling of glutathione. The B vitamins are a very important part of our glutathione going from a reduced state, and then it serves as an antioxidant. It gets oxidized. And if I don't have all of those other micronutrients that we just talked about, then I'm stuck with an oxidized glutathione that can't go back and start to help and do that antioxidant capacity again. So that's a very important part. And I think that's something that's often neglected. There are a lot of people who will give glutathione, and it's not as effective as it can be because they don't have the other micronutrients to help recycle.
That help it perform to the level where it needs to be.
And to continue to kind of go back around and perform like it should.
So obviously you're like the science brain behind everything we do as a chief medical officer. So let's dive a little bit deeper on glutathione.
Mm-hmm.
What is glutathione? Our bodies naturally produce it, right?
Yep.
So for the people that don't understand glutathione and the importance of glutathione, like what is it? Where does it start? Where does it come from? And why do we supplement it?
So our body, we make glutathione primarily in our liver. The glutathione is made as a combination of 3 separate amino acids, glycine, glutamine, and cysteine. Okay, and then we actually make glutathione as what we call Mother Nature's master antioxidant.
Wow.
Okay, it's the master rust buster.
The master rust buster.
The master rust buster.
I'm gonna have to trademark all these things you're coming up with. I love it.
I like to make, but when I talk about these things to my patients, I like to make it clear as to kind of what these things are doing, because when they understand, and particularly if I talk about doing glutathione drip because you need it for detox or for whatever reason, if they can understand exactly what's happening, they're much more likely to be compliant with whatever we recommend. And so I think it's important to understand that. So, but glutathione is that master antioxidant. I mean, so it serves as, it even can bind toxins and kind of help take some toxins out of the body. But the major role of it is to deal with the oxidative stress that's caused by whether it's infections, whether it's heavy metals, whether it's anything that causes this oxidative stress in our body. Glutathione is that major molecule that actually is used to kind of balance that out or kind of to deal with that.
Okay. All right. And then the other nutrients, you said for glutathione to actually do what it needs to do, you need to have the other nutrients.
Those other nutrients are really important in the recycling of that glutathione, because once we've used the glutathione, once it goes from this reduced form. So, for example, when we give glutathione to our patients, we're giving a reduced form of glutathione. And once it's reduced and it goes to bind that oxidative stress, whatever that oxidative stressor was, now the glutathione is oxidized. Okay.
Right.
So if our bodies are not able to convert that oxidized glutathione back to a reduced form, then my glutathione levels are extremely low. I don't have the ability to now deal with any more of the oxidative stress that is actually whatever the body faces.
Right.
So to be able to recycle and go through that pathway, we have to have those micronutrients in place. And there's a lot of components also of genetics that play a role. We can have gene variants that we don't make as much glutathione. And so a lot of what I do is, from a personalized perspective, is looking at detox genomics, which include the glutathione genes, and determining, okay, if you have gene variants, and I know that it is very important that we optimize micronutrient status and optimize glutathione status, because your body is not making it as efficiently as, John Doe down the street.
All right. So, Dr. Davis, with something like the natural defense, what are people supposed to, let's say someone is feeling a little under the weather and they want to come and get that vitamin C IV drip, the natural defense. What should they expect? How are they going to feel? Is it going to shorten up their symptoms? Like what should people expect? What should medical practitioners that are listening to us expect for their patients to feel?
Right. I think what I've experienced, what I've personally experienced and what I've seen in my clients, certainly the length of an illness, when we give the natural defense, the time period is shortened. That feeling miserable sensation for, when I have the flu, it's definitely shortened from, if I didn't do it, I'm just going to give you, about numbers. But if I didn't do it, I'm suspecting I would have these symptoms for 5-6 days. When I do it, within 2 to 3 days, I'm feeling pretty good.
Nice.
And that's been my experience with most of my clients as well. I mean, we can, and part of it also is the hydration status of it as well. When we give that, there is a hydration component. People feel miserable. One of the things that I don't think most people realize that when you feel tired and headachy and that type of thing, a lot of that is dehydration as well.
Okay.
And so when you are rehydrated, you just tend to feel better in general. But I think certainly I've seen, and I can say pretty consistently, the time course of how long the symptoms last is definitely lessened.
Awesome. So we got some of the things on the nutrients IVs. We talked about ascorbic acid, the vitamin C, the different B vitamins. We even talked about glutathione, even though it's not in the natural defense, but it can still benefit you. Which you could always add it as an add-on. What about vitamin D3? Vitamin D.
Yeah. So I think we all know that. We've talked. Vitamin D has so many roles, and we call it a vitamin, but in fact, I think we've all kind of heard that vitamin D is actually considered a hormone.
A hormone, yeah.
And people will ask about, well, can I get vitamin D in my IV? Well, let's just make this clear now. We can't give a vitamin D in an IV because it's a fat soluble vitamin. So don't ask that question anymore to anybody
You'll
else.
feel like crap.
Yeah, right? So we don't want to do that.
If you start coughing nonstop, they probably put vitamin D in your IV. Make sure that that's not the case. Never do that.
Never do that.
Yeah.
But vitamin D, it has so many, from an immune system perspective and optimizing immune system efficiency, but also, so many other roles. The biggest thing that's important for vitamin D as a cardiologist and cardiometabolic person, it is super important in insulin sensitivity, right? People who have metabolic syndrome or diabetes, when your vitamin D is low, your insulin is not going to work effectively. Your glucose is not going to bind an insulin receptor effectively. So vitamin D is an extremely important part of improving insulin sensitivity as well. So I'll get back to the whole immune system thing. I think that we clearly saw and I don't want to really get into the whole COVID thing for too long, but we clearly see with many studies with COVID, the role and the improvement in symptoms when vitamin D levels were, as opposed to being at our normal 30 levels, when we keep vitamin D levels in the 60 to 80 range, which is where I would suggest that we all try to keep our vitamin D levevels in that 60 to 80 range.
80. Okay.
We clearly saw that the data showed that people were doing much better when we had higher vitamin D levels.
So let me ask you this: with the vitamin D, what is the typical, based off your case studies that you've had yourself? What is your recommended frequency of vitamin D3 dosages that people typically follow when it comes to like the D3 injections, or even like the oral supplementation?
Yeah.
If they got a good gut, right?
It depends on how low the person is, right? If the person comes in with the vitamin D level of 11 or 17 or something like that, which I've certainly seen. I think the lowest I've seen is a vitamin D level of 9.
Wow.
It depends on, again, I said I use a lot of genetics in my practice. If they have VDR or vitamin D receptor gene variants, and I know that whatever the vitamin D, they have issues binding, the vitamin D has issues binding the vitamin D receptor, I will do more often. But I would say it really depends on where you start. If I have a person who comes in and they have a vitamin D level under 20, then I am starting out with 50,000 units. If I'm doing it intramuscular weekly for probably 4 weeks, 6 weeks, and then kind of starting them on, and while at the same time starting them on an oral regimen of 5,000 probably a day.
Okay.
Vitamin D doesn't go up super quickly if you just do it orally. So I do think that when we get those people who are super low, I will do the intramuscular injections. If you come in and your vitamin D level is in the 30s, which is considered normal, 30 something. I don't always do intramuscular vitamin D level. I'll do just oral vitamin D then, and I'll start at 5 or 10,000. I'll start at 10,000 for a month, maybe, or two, and then go to 5,000. Most of my people end up on vitamin D at 5,000. I do always go back and check it. Are
you doing just vitamin D or you
K2 always?
With the K2?
Yeah, this is important. This is a very important point. Thank you for that comment. I always recommend, and I don't think that there are any really exceptions to this. I always recommend doing vitamin D and vitamin K together, vitamin K2 to be more specific.
And what does that do?
So vitamin K is very important in directing calcium in the body. What I mean by that is vitamin D helps in the absorption of calcium from the gut. And vitamin K, I like to call as a traffic director. So when I'm vitamin K deficient and I have lots of vitamin D and absorbing lots of the calcium, what ends up happening is calcium ends up in places it shouldn't end up. It ends up in, calcium shouldn't end up in my bones and teeth, right? But calcium ends up in places like my heart arteries and heart valves where my vitamin K2 is low, because now I don't have that director of traffic anymore. Wow. So vitamin K2 is very important to be taken with vitamin D.
With vitamin D.
And 90% of people are vitamin K2 deficient. And I can say that from all of the micronutrient panels that I've done.
Wow. So vitamin D3 with K2 is a must.
Must.
Okay. All right. And what's the typical dosage of the K2?
So the K2 is anywhere, it's about 90 to 100 micrograms, I think it is in there. And most of the supplement companies, the pharmaceutical grade supplement companies will have a good mix
the combination
of K2, D3,
of it,
combination
right?
of the K2, D3 in their product.
Okay. That's awesome. Is there anything else? Like we talked about taking the first few steps, right? The nutrition is important of doing it. What else can people look at when we're trying to enhance people's immune systems? Like we talk about the frequencies of the D3 and whatnot. So someone who's trying to like just enhance their immune system throughout flu season, because people are doing a lot of traveling and everything else. Like what is the typical frequency of doing some of these natural defense strips, just more as a preventative, measure?
Yeah, I think you'd be safe, even if we said during flu season, if we did once a month natural defense. I think and I don't think there is everybody is an individual and has their own underlying biochemistry, right? They have their own detox pathways, and so it's hard to give a generality. Okay,
it has to be more personalized.
Right. If you're somebody who has underlying immune issues and asthma and other autoimmune things, then it's a little bit different than if I'm a fairly healthy person just trying to be, protect myself from the flu. So I think it really does depend on each individual. But if you're just a healthy person with not a lot of other comorbid illnesses, then, a monthly natural defense, I think, is more than reasonable.
Right. So, Dr. Davis, a lot of information here, man. Good information, especially with how I said flu season coming up and everything else. Obviously, these IV drips, these intramuscular injections, they have so many other benefits besides just boosting up the immune system. What are some of the few things that people have to also understand that they're going to get as a benefit from doing this?
That's a really great question. I'll say this. Before I actually got involved with Liquivida, I didn't know much about micronutrients. And I think that the one thing that we all take for granted is the role of the B vitamins. We can say most people understand and they say my B12 is this or my B12 was high or low. But the reality is all of the B vitamins, vitamin B1, thiamine, B2, riboflavin, folate, which is vitamin B9, pantothenic acid, B5, B6. All of these B vitamins are so important for so many reactions in our body. There's a lot of talk about this process called methylation now, and methylation has a lot to do with how we age. It has a lot to do with cancer. It has a lot to do with Alzheimer's. It has a lot to do with heart disease. And it's amazing to me the number of people who are seriously B vitamin deficient, thiamine, riboflavin, have never had levels checked, period. We talked about that earlier. Everybody knows what their B12 level is, and they're taking B12 shots and B12 lozenges. But it's so important, and we can get people feeling so much better by improving this process of methylation. And all of our drips have, fair amounts of these B vitamins in them. And so for me, when I started to measure the levels and see intracellular how everybody was B vitamin deficient and understanding the role of these B vitamins now, I can't begin to tell you. I just talked about all the, neurocognitive things or psychologic things like the anxiety and depression and insomnia, how those things get better, energy levels, because we are now giving the body what it needs. We're giving the mitochondria, and this is for a different day, what it needs to do its job in producing oxygen and producing energy. Right. So I think that, the benefits are endless just by thinking about the role of the B vitamins, because we've not really paid much attention to anything but B12.
That's the truth, man. Dr. Davis, man, you got so much knowledge, man. You are an incredible physician. I learn so much every single time I talk to you. Knowledge is power, right? And this is just a little taste of what people need to start understanding when it comes to this more proactive approach to their health, right? If people want to find you, obviously you have your concierge practice in Sarasota, Reveal Vitality. If people want to hear more and find you, how do they find you?
Well, you can find me at Reveal Vitality. RevealVitality.com is my website for my practice in Sarasota. Obviously, we can find me through the Liquivida website as well. I mean, I think that, as Deion Sanders said, I ain't hard to find. But we are. I think one of the goals we have here at Liquivida, we really want to change the way people approach healthcare. We want to change the way most of us think about the importance of healthcare. We want to make being healthy part of being fun. It's what we need to do. So it's about changing the narrative of what health is. And I think if nobody gets out and start to talk about it, it's about educating people. I mean, I can talk about all the miseducation that we've had. We go to the web and there's a lot of miseducation out there. Even as a physician, I will say that there was a lot of miseducation I had. But part of my journey that continues to go on is just to continue to learn as much as I can so that I can provide it to all my clients and I can provide it in stages like this to try to educate people about how important it is that we follow the right path so we can take care of ourselves. We don't have to be sick. We don't have to have all the chronic disease that we have in the world today. We don't have to have 2 in 5 people having multiple chronic diseases. So, it begins with looking under the hood and not practicing a Band-Aid approach to kind of medicine by taking this medicine for this illness and that medicine for this illness. It's about looking at the reason and the underlying root causes of why we're sick.
That's the truth, man. That's the truth. Dr. Davis, a lot of people are going to ask a few more questions, right? So we're going to give them the answers. These are going to be more of fun facts, right? What's your favorite color?
Blue.
All right. Well, that's my favorite color, man. Okay. What are the fun facts besides being a good dancer and stuff? What are give us 2 more fun facts for people to know? They can know besides being a physician, what else about you that it's hard for them to even know that?
I love fitness. I have horrible ADD. That's what I can tell you.
We got nutrients for that.
But that ADD, I think, it's a strong point as well because it keeps me driven. And what else? What would my wife say? I don't know. I can be pretty funny when I let loose. I like to let my hair down and have fun. Most people think about when I'm talking and speaking, everybody thinks I'm kind of all stuffy, but at the end of the day, that's not me at all. I'm 100% different than that. So
right, and I learned today the new light skin pose. There you go. Awesome, Dr. Davis. It was a pleasure, man. Like always, we got more coming for everybody as time comes. Any questions that anyone has, please let us know. Comment below. Click on all the links. Go on our bio. Do whatever it is. Follow us. This is Dr. Davis. You'll see more of them. Thank you for tuning into a Healthy Point of View podcast.